Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What is a carcinoid tumor? Carcinoid tumors are rare, slow-growing tumors that can arise in several places throughout the body. Carcinoid tumors are a subset of tumors called neuroendocrine tumors, NETs, that usually begin in the digestive tract, stomach, appendix, small intestine, duodenum, colon, or rectum, or in the lungs. In some cases, carcinoid tumors can begin in other parts of the body, such as the testicles or ovaries. /r/n/r/n While carcinoid tumors are cancerous, they are unique in that they are considered to be cancer in slow motion. In rare cases, carcinoid tumors may metastasize, spread to other areas of the body. /r/n/r/nVerywell, Jessica Olahrnrn If you have a carcinoid tumor, you may have it for years and never know it. Carcinoid cancers grow very slowly. They are typically diagnosed after age 55, but they are also diagnosed at a younger age. /r/n/r/n Carcinoid syndrome occurs when a carcinoid tumor releases specific chemicals, such as serotonin, into your bloodstream. Fewer than 10% of people with carcinoid tumors have or develop carcinoid syndrome. However, this statistic may vary based on the location of the tumor and when it is diagnosed by a doctor. /r/n/r/n Among carcinoid tumors, gastrointestinal tumors make up 60% of all neuroendocrine tumors. The incidence, frequency of disease, of carcinoid tumors is greater in black people than in white people. Black men also have a higher risk of developing carcinoid tumors than black women, although these factors are understudied. /r/n/r/n The symptoms of carcinoid tumor depend on where it is located in the body and where chemicals are secreted in the bloodstream. If the carcinoid tumor is located in the digestive tract, symptoms may include /r/n/r/n If the carcinoid tumor is in the lungs, symptoms may include /r/n/r/n Scientists do not know what causes carcinoid tumors. However, cancers occur when cells develop mutations in their deoxyribonucleic acid, DNA, humans' hereditary material. The mutations enable cells to grow and divide uncontrollably, whereas healthy cells would normally die over time. As these mutated cells accumulate, they grow into clumps of cells known as tumors and may invade nearby tissues or metastasize. /r/n/r/n However, some studies have shown that patients with a rare condition called multiple endocrine neoplasia type 1, MEN1, have a higher chance of developing bronchial and intestinal carcinoid tumor. This suggests that the MEN1 gene may play a role in carcinoid tumors of the lung and digestive tract. /r/n/r/n Small carcinoid tumors may be difficult to detect and therefore difficult to diagnose. Often, these tumors are detected during surgery or in an exam for another condition. However, there are tests that can be used to detect carcinoid tumors, including /r/n/r/n If small carcinoid tumors have not spread yet, the best treatment is surgery. If the tumor has become too big or has metastasized, other treatments that are available include /r/n/r/n According to the American Cancer Society ACS, the 5-year relative survival rate of people in the United States who are diagnosed with gastrointestinal (GI) carcinoid tumor is about 90%. However, this percentage may change depending on how far the cancer has spread, a person's age, overall health, and available treatments. /r/n/r/n The SEER, Surveillance, Epidemiology, and End Results database tracks the 5-year relative survival rates of people with GI carcinoid tumors based solely on how far the cancer has spread. These categories include localized, regional, and distant stages, which are /r/n/r/n Each person with cancer develops their own way of coping. But you don't have to do it alone. If you have questions or would like guidance, talk to a healthcare professional. Also consider the following steps to help you deal with your diagnosis. /r/n/r/n carcinoid tumors are rare, slow-growing tumors that are part of a subset called neuroendocrine tumors, NETs. They can arise in several places throughout the body, such as the digestive tract or in the lungs. Symptoms vary depending on location of the tumor and where chemicals are released in the bloodstream. /r/n/r/n small carcinoid tumors may be difficult to detect and, therefore, diagnose. However, once found, there are many options for treatment. Treatment options include chemotherapy, surgery, medications, and liver treatment, if the tumor has spread to the liver. /r/n/r/n the survival rate for those with carcinoid tumors is promising, especially if the cancer has not spread. /r/n/r/n a tumor or cancer diagnosis can cause stress, anxiety, and depression. It's important to remember that these feelings are normal. Do not be afraid to have open and honest conversations with your healthcare provider about treatment options. Seeking support from others who are facing a similar diagnosis can also be beneficial, as they can share their experiences with various treatments and provide emotional and psychological support. /r/n/r/n Most importantly, do not give up on hope. On average, the relative survival rate of GI carcinoid tumor is high when appropriate and immediate treatments are utilized. In general, cancer treatments and survival rates are improving. It's estimated that there are 18 million cancer survivors in the United States, and that number is growing. Not only are more people surviving cancer, but many are thriving, with a new sense of purpose and appreciation of life after their disease. /r/n/r/n/r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.